Tamo had cerebral palsy since birth. He tried many different treatments unsuccessfully. When he arrived at hospital, he couldn't walk. After 7 days of Mongolian mind-body interactive psychotherapy, he slowly started walking. After a month of treatment, he went home and rehabilitated. After 52 days, he was walking better. His foot inversion was still severe. But a year later, he could move his hands, run and attend school. His condition has improved significantly. Fu Tiangrongzi suffered from psoriasis for 30 years. Despite many years of searching for solutions, nothing worked for her. It made her life miserable. She was introduced to Mongolian mind-body interactive psychotherapy, and on the 3rd day, the psoriasis on her head had all fallen off. After 4 months, her psoriasis improved by 95%. After 6 months, she was fully recovered. A follow-up visit after 5 years revealed she is no longer suffering from any skin problems. Nahiya, a 15-year-old student, one day suddenly lost her voice, and it lasted 32 days. She visited 2 of the top hospitals and was put on drips for 18 days. It didn't help. When she arrived here, she still couldn't talk. Only on the 3rd day of receiving the Mongolian mind-body interactive psychotherapy, 2 hours after the face-to-face consultation with Dr. Na, she started to talk, though her voice isn't quite like her usual self. On the 2nd day, she was completely okay. A follow-up visit after 5 years revealed she is doing just fine. Damu Chai began suffering from drooping eyelids and headaches. He was diagnosed with a brain tumor. He would need surgery, which was risky. He couldn't afford surgery and didn't want to risk it. He decided to see Dr. Na and try Mongolian mind-body interactive psychotherapy. After 7 days, something came out of his nose. He opened his eyes and felt no pain. A CT scan 3 years later showed the tumor was gone. A follow-up visit after 7 years revealed he is doing okay. Hasi Tuya was diagnosed with a pelvic tumor. Prior to any treatment, her type B ultrasonic results showed that the pelvic mass was about 4.1 pounds, 4.3 centimeters. CA125 is 102.6. The CT scan showed a high risk of malignant tumor on both sides. After receiving 12 days of Mongolian mind-body interactive psychotherapy, the type B ultrasonic showed that one side turned into an annex cyst. 20 days later, the type B ultrasonic showed that the right side had turned into an inflammatory mass. 21 days later, it became pelvic fluid. CA125 became 37.2. 35 days later, the type B ultrasonic showed that there was nothing abnormal. CA125 became 28.4. This patient has since then come back twice every year for maintenance purposes. A follow-up visit was made after 3.5 years and she is doing fine. Dabutilatu was diagnosed with tuberculosis of the bones and brain, paralysis and loss of eyesight. Doctors told his family to prepare for his death. He started receiving Mongolian mind-body interactive psychotherapy, and on the 3rd day, a large pustule of tuberculosis on his hip bone disappeared. Day 7, he got his sight back. Day 14, he could hold on the wall and walk. Day 16, he was discharged. In total, he has received treatment for a month. He spent 2 months doing rehabilitation. 3 months later, he could walk. 6 months later, he could run. One year later, his examination showed that everything was normal. He is now a successful entrepreneur. Hada was diagnosed with psoriasis 18 years ago. He searched for all kinds of treatments. During the early years, his condition was unstable and got worse. After starting treatment from the Mongolian mind-body interactive psychotherapy, he shed lots of his psoriasis. What you are seeing now is a month's worth of skin that fell off of him. The good news is that after 6 months of receiving treatment, he stopped taking all his hormonal medication. His condition improved by 90%. What you are seeing now is the skin collected from his bed for the last month. 1 year later, he was fully recovered. 3 years later, he was married and settled down. A follow-up visit was made after 5 years and he is absolutely fine. Wu Riga was paralyzed due to a fall during a race. She was in a coma for 3 days. During those days, she was treated in 2 top hospitals, but they found no particular cause to her paralysis. Hormonal medication was being used from both hospitals, but they found no improvement. Then she started receiving Mongolian mind-body interactive psychotherapy. On the 3rd day, she had a face-to-face consultation session with Dr. Na. On the 4th day, she was able to walk normally. A follow-up visit was made after 3 years and everything is fine. This is, in fact, a typical case of conversion disorder caused from psychological illness. Kiki Gema was diagnosed with leukemia. Initially, the white blood cell count was 326,000. For 5 years, she had been taking oral chemotherapy drugs. However, the white blood cell count was still as high as 68,000. After 36 days of receiving Mongolian mind-body interactive psychotherapy, her white blood cell count has dropped to 45,900. 57 days later, her white blood cell count has come back into normal range. Li Wan suffered from muscular weakness for 6 months. When the condition kept getting worse, he went to see a doctor and he was diagnosed with systemic polymyositis. He received treatment for a week with little improvement. When he started to receive treatments from Mongolian mind-body interactive psychotherapy, on the 3rd day he could look up and walk independently. 14 days later, he could walk much better. On the 30th day, he returned home, and after 2 months, he returned back to work. A follow-up visit was done 1 year later. He looks much more energized compared to before. Another follow-up visit was done 10 years later, and he is strong enough to carry on with any heavy physical work. Alata was diagnosed with thrombocytopenic purpura and she had only 2 units of platelets. After receiving treatment from conventional medical methods, her platelets had risen back to 10. When she started receiving treatments from Mongolian mind-body interactive psychotherapy, after 21 days her platelets rose to 82 units. And on the 48th day, her platelets were back to normal. A follow-up visit was done after 4 years and she is absolutely fine. Ayotigen Kikige suffered from paralysis of the lower limbs and was diagnosed with syringomyelis and myelitis. Treatment at hospital didn't help at all. When she arrived here, she was sitting in a wheelchair and her lower body had lost consciousness. After receiving treatments from Mongolian mind-body interactive psychotherapy, on the 5th day she was able to walk with others helping. On the 8th day she was able to walk independently. On the 25th day, she was able to run and was fully recovered. A follow-up visit was done after 9 years and she is doing great.